Before the participant arrives, we want to make sure that we have everything prepared. So what we need to do is, let's see, we want to prepare the water bath. So we want to put the ice in the water bath. We want to put one of the tuning forks in the water bath so it can get to the cold temperature. We want to collect all of the materials. So we need the Siemens Weinstein filaments that we're going to use, which is number 6.45. We have the 2 metal tuning forks. One will be put into the water bath beforehand. This should happen at least 15 minutes beforehand. The other one will be left out. We want to have the blood pressure monitor ready. We want to have a thermometer available to measure the skin temperature and the temperature of the cool stimuli when we present them. We want to have a tape measure. It's nice to have the pain intensity and unpleasantness rating graphics, and I'll show you those in a few slides. Then we want to make sure that we have a copy of the participant's most recent INSCI exam, so we know about where, so we know where the neurological level of injury is. And then we also want to have the key sensory points document for reference. That is helpful. The key sensory points that are used in the ASIA examination. So that is helpful for us when we're choosing test sites and to know which site we would choose for particular dermatomes. Once we have collected all of our materials, we should keep these all in the same place. We want to make sure that we have wiped the tip of the Siemens Weinstein monofilament, the tuning forks that are going to be coming in contact with the skin. So the circular ends, the flat circular ends, where we're presenting the cool stimuli. And we want to wipe those down. We want to wipe down the blood pressure cuff with alcohol wipes and any other thing that we think will come into contact with the participant. So when the person gets there, we will, establish a rapport, and then for the baseline testing, we are going to have the participant in the lying down, if possible. If the person's already in a wheelchair, they just got back from therapy or whatever, and they don't want to transfer to their bed right now, they want to sit up, or for some reason they are some other reason they need to be in a chair, then we can test them sitting. Follow-up testing will test the participant in his or her wheelchair or whatever is most convenient. But we've decided that for baseline testing, we will test them supine in their hospital bed, and for follow-up testing, we can test them in the wheelchair. We want to make sure that we reduce distraction before we start anything. Turn off the TV, ask them to put their cell phone away and make sure that it is on vibrate or turn it off. And then once we have set that up, we read the introductory script to them. We want to take the room temperature. We want to record the time, who's performing the testing. That would be you, whoever is the study staff that's doing the testing. And if there's more than one person that's helping with the testing, we record whether their initials or their names. And then if anyone else is present besides the participant, if the participant's mother happens to be in the room or someone else happens to be there. And then we check off, read the script, then we check off what position the person is in for testing, and then we can go ahead and take their blood pressure with the automated blood pressure cuff and record that. After we do that, we're going to ask them a couple of questions. The first one is whether or not they're experiencing anything right now. And so they can say yes or no, and then we will ask them to rate it on a scale from 0 to 100. And this is where one of the graphics will come in. It's nice to have this on a piece of paper. It's very commonly used. People generally understand it, but it's kind of nice to have a visual, particularly when we try to ask them later to differentiate between pain intensity and unpleasantness. So this is the 0 to 100 scale, not 0 to 10. We're going to use 0 to 100. So 0 means no pain, and 100 means the most intense pain imaginable. And then we'll write down their rating. If they have pain, we'll write down their rating. Okay. Then we will also, the second question here is to ask them if they know of any areas in their body where they have unusual sensitivity. If there's heightened or uncomfortable sensations in certain parts of their body, or any unusual sensations, then that will help us to know areas to target and not to miss when we're doing some of the other testing.